Have you ever felt like you needed to cut down on the amount of time you watch Sketchy Micro? Do you ever get annoyed by your non med school friends who think you're spending too much time studying? Do you ever watch Sketchy Micro first thing in the morning, maybe to calm your nerves or make you feel a little less anxious? Well, if you answered yes to two or more of these questions, I think it's time for a little intervention. You need to give Sketchy Micro a break. Go do something productive with your life. Pick up a hobby, like try drinking alcohol. I don't know. Remember back in the day before you got hooked on Sketchy Micro, when you'd spend your Friday and Saturday nights going to bars and socializing with people that do interesting things? Go drink more. Jeez. Get a life. You're still here. Alright, you're a lost cause. At least we'll make this scene about bars and alcohol. And not just any bar. This is Epstein Bar. Get it? Ye Old Epstein Bar, in honor of our next member of the herpes virus family, the Epstein-Barr virus, or EBV. Alright, remind me what type of genetic material it contains. That's right, junkie. Double-stranded DNA, which you knew from our blue dominant color scheme going on. EBV causes infectious mononucleosis, or in lay terms, mono. If you've ever had mono, you probably remember how much it hurt just to even think about swallowing. And yep, the last place you'd want to be is at a bar. In fact, that's probably where you got it. Alright, we have a lot of info to go through, so let's get cooking. Let's start with a review of the basics of the infectious process itself. Mono is often known by the name the kissing disease because it's primarily transmitted through saliva when you're sharing a drink or perhaps a sloppy kiss. So let's look at the couple sitting here. This girl's probably had too many drinks and wants to kiss this guy. And as you can see, she's pursing her lips and saliva is falling out of her mouth. However, she may not want to get too close to this guy because it looks like he's got mono. He's sweating from a fever. In his nervousness, he's knocked over this drink and has gotten it all over the knight standing behind him. The knight, who's furious, grabs a man on the back of the neck, which illustrates this tender lymphadenopathy that people get with mono. Notice it looks like he's yelping in pain. Although it generally occurs in the posterior cervical region, what distinguishes it from other causes of pharyngitis is that the patients can also get generalized lymphadenopathy. So what's the deal with this knight? You'll notice that his armor has a T on it because he's a symbol for a T cell, a type of white blood cell important for cellular immunity. If you look closely at the shoulder armor and the hilt of his sword, they have the number 8s on them. And do you remember which T cell has a CD8 marker? That's right, the cytotoxic T cells, which are basically your immune system's version of knights. And with this awesome sword, you know he's got to be one mean killing machine. Because the mono guy knocked his drink over, the knight is reacting to having a drink spilled on him. Reacting in a violent way, but nonetheless reacting. This is to represent the reactive lymphocytosis seen in a blood smear under the microscope. These reactive lymphocytes also go by the name of Downy cells, or atypical cells. Come to think of it, the wine stains on his clothes look just like one of these cells. Wow, who comes up with this stuff? You'll notice that they're very large with lots of cytoplasm, and they'll have either an oval or indented or folded nucleus. For future reference, these atypical lymphocytes are often associated with EBV or mono on test questions, but in reality, they can be seen in a number of different settings. Atypical lymphocytes are mostly CD8 cytotoxic T cells, but they can also be natural killer cells. In response to the infection, the T cells proliferate, which is why your lymph nodes and spleen become enlarged. This splenomegaly is being illustrated by this random cow behind the bar. Who knows, it's medieval times, and Epstein's an eccentric guy. Anyway, notice that he has a spleen spot to remind you of splenomegaly. Some cases also have hepatomegaly, but it's far less common than enlargement of the spleen. Alright, so let's go over what happens when the virus is transmitted. When the virus encounters a new host, it targets the B lymphocytes. If you recall from immunology, the B lymphocytes are the white blood cells that can either turn into the plasma cells and make antibodies, or remain dormant, ready to make antibodies in response to another infection. Sticking with our medieval theme, we're going to use archers to represent our B cells. They guard the castle and shoot off arrows, which in many ways are a lot like antibodies. Whereas T cells are knights, which actually run up to and attack the enemies. So where is our B cell in this picture? Here he is, asleep with his bow laying next to him. Notice how he's wearing a white outfit to represent that he's a white blood cell, and his arrows look like antibodies. But why is he asleep? Well, he's supposed to represent a latent B cell, hence a sleeping archer. Recall that EBV remains latent in B cells. So how does this B cell get infected? To infect the B cell, the EBV envelope glycoprotein binds to CD21, which is actually the receptor for the complement component C3d. You can remember CD21 as the marker for B cells because you must be 21 to drink, at least in the United States. This sign is posted up here to remind us of this. So EBV binds to CD21 to infect B cells. Alright, let's talk more about the clinical picture. EBV is more than just fever, lymphadenopathy, and splenomegaly. Another key feature of mono is pharyngitis. And if you look closely at this man's mouth, you'll see he has tonsillar exudates that are so copious they're actually coming out of his mouth. He's drooling. And anyone who's had mono remembers that the white junk at the back of their throat can be pretty copious and disgusting. Remember that test writers may try to make you distinguish strep pharyngitis from mono, which are caused, of course, by two very different organisms, so you should definitely know the differences between the two clinically. For example, strep pharyngitis is more often seen in children and adolescents, whereas mono, although it can and does occur in children, is usually asymptomatic at a young age. But those who are infected in their late teens or adulthood are more likely to be symptomatic, and as you can see, there aren't any children in this bar. Well, not yet at least. On a side note, another way you might see this come into play is a patient presents to a doctor's office with severe sore throat, so the doctor, suspecting strep pharyngitis, gives him amoxicillin. Patients with mono who get treated with amoxicillin, or its IV counterpart, ampicillin, develop a maculopapular rash. And we'll help you remember this with this guy here drawing red spots with his pencil, our symbol for the penicillin family. So he's chiefing this poor archer. The pencil in this case is red to remind you that penicillin is not the treatment for mono, but it's often given and can cause an adverse reaction. Although other antibiotics can be associated with this reaction, the classic drugs to remember are amoxicillin and ampicillin. In case you were wondering, this rash is not an allergic reaction, and the actual mechanism is not fully understood. EBV is associated with other diseases other than just mono. It's also a risk factor for some cancers. There are three main cancers we want you to focus on. And before I describe them, what is our recurring symbol for cancer? That's right, it's a crab. So you'll see our bar patrons who represent these cancers are all consuming crab. Alright, in patients with weakened immune systems, EBV is associated with a higher risk of developing a type of B-cell cancer known as B-cell lymphoma. B-cell lymphoma can be divided into two main groups, Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin's lymphoma is characterized by the Reed-Sternberg cells that look like owl's eyes, which we'll represent with our stern owl picture here, where he's sitting amongst some reeds, for Reed-Sternberg. Although EBV is associated with some, but not all of the subtypes, the one to remember is the mixed cellularity subtype, as EBV is seen in 70% of cases, and the Reed-Sternberg cells are fairly common. In terms of non-Hodgkin's lymphoma, there are several different types, but we'll just mention one, which is Burkitt lymphoma. Burkitt lymphoma, which will be represented by our bar kid, is associated with EBV. Endemic, or African Burkitt lymphoma, presents with a large lesion in the jaw with swelling, which is why this kid is dressed in African clothing and has a large mouthful of crab that's puffing out his cheeks. Remember that in non-endemic or sporadic Burkitt lymphoma, it develops in the ileocecum and peritoneum, not the jaw. And for you oncology buffs out there, the most common translocation for this is T8 to 14. The third cancer association for EBV is with nasopharyngeal carcinoma, which is often seen in people of Asian ancestry. So here we're going to draw in a gentleman wearing a Komodo, and a crab is pinching this poor man's nose. Someone clearly didn't cook the crab quite enough. It's pinching his nose to remind you of nasopharyngeal carcinoma. All right, the last disease associated with EBV is oral hairy leukoplakia. Try saying that 3 times fast, which is most often seen in patients with HIV. In contrast to the cancers I just mentioned, you should know that oral hairy leukoplakia is not a precancerous lesion and does not develop into squamous cell carcinoma. So to illustrate this, we're going to draw this bearded man in the back of the bar. In this case, we're representing HIV with a cane, and you see how he has his hair surrounding his mouth? No, that's not how the disease presents, but it should remind you of oral and hairy. Specifically, these lesions usually occur on the lateral portions of the tongue and may look a lot like Candida, which causes oral thrush. But unlike Candida, you can't scrape it off the tongue. Alright, so how is EBV diagnosed? During the acute infection, EBV activates B cells to secrete heterophile anti-sheep red blood cell antibodies. The presence of these antibodies is used to make the diagnosis of mono, as they will agglutinate or clump sheep or horse red blood cells. A form of this test is known as the monospot test, which can rapidly diagnose mono in the clinic. The monospot test is demonstrated by our medieval darts board. Come on, every pub needs a dartboard. See how the darts are clumped in the single middle spot, thus monospot? And the darts are somewhat star-shaped with 5 points, just like IgM molecules. Alright, so now how do you treat mono caused by EBV? Well, it's mainly supportive therapy, but one of the things you must tell your patients is that they must avoid contact sports due to the risk of splenic rupture. Note that splenomegaly occurs in 50 to 60% of people infected with mono. Thus, we have a sign here that says, "No contact jousting allowed in the bar," to remind you to warn your patients not to participate in contact sports. So after this long tour of EBV, the key things to remember are the features of infectious mononucleosis, the 3 major cancers EBV is associated with, and oral hairy leukoplakia in HIV patients. Alright, that's enough. Now off to the bar. Go drink. I'm tired of being your enabler.